The following is important information for those who may have experienced the loss of a child during pregnancy or after birth. It is intended to help patients and families make decisions and to become aware of options during a very difficult time. Perinatal loss is one of the most devastating events a family can experience. There are several types of perinatal loss. Miscarriage refers to a loss before 20 weeks of pregnancy. Ectopic pregnancy is one in which the embryo grows outside of the uterus, often in the fallopian tubes. Medical interruption is when a pregnancy is ended due to severe abnormalities in the baby or severe medical complications with the mother. Stillbirth refers to a loss after 20 weeks of pregnancy and before delivery. Neonatal death occurs when a baby is born alive but passes away within 28 days of life. It is estimated that 1 in 4 pregnancies ends in a loss. Pregnancy loss is a very sad experience. Miscarriages are common, occurring in 15 to 20% of pregnancies. They usually happen in the first 8 weeks, and most times the reason is unknown. This can mean the fetus was not developing properly. Even if you experience 1 or more miscarriages, you still have a good chance of having a future healthy pregnancy. Common signs of miscarriage include vaginal bleeding, passage of clots or tissue, cramping or pain in the pelvis or lower back. It is important to take any vaginal bleeding seriously and contact your healthcare provider. Many women who experience bleeding continue the pregnancy without further problems. Discuss any concerns or questions you may have with your healthcare provider. There is no treatment to stop a miscarriage. It will usually occur on its own over the course of several days. However, sometimes a medical procedure called a D&C will be conducted or a medication given to help clear out any remaining tissue. An ectopic pregnancy treatment requires medication or possible surgery. A second trimester miscarriage or medical interruption of pregnancy may involve an admission to the hospital. Medication will be given to induce labor. Stillbirth risk factors include smoking, obesity, diabetes or high blood pressure, infection, previous pregnancy loss, multiple pregnancy, trauma, mothers aged less than 20 or over 35. In many cases, the cause of stillbirth is unknown. Some can be related to a problem with baby, placenta or umbilical cord, or a serious health problem with the mother. Stillbirth occurs in about 5 in 1,000 pregnancies. Once a stillbirth is diagnosed, your healthcare provider will discuss with you and your support person the reason why and how labor will be induced. For example, with medication or by having your water broken. There will be a nurse assigned to your care who will provide support and answer questions. Pain relief options are available during this difficult experience. Every woman and family will experience loss differently, and coping strategies vary. What to do after a loss is an individual decision. It is okay to take time to consider the choices that are right for you and your family. Your healthcare provider will discuss the following choices to consider. Who would you like to have with you at delivery? Would you like to view or hold baby? Do you have a special outfit or blanket for the baby? Do you wish pictures to be taken with or without family members? You and your support person will have the opportunity to see, hold, and bond with your baby. Research indicates this is valuable for most families, but is an individual choice. It is normal to have a wide range of emotions, and your healthcare provider will be mindful and sensitive to your needs and wishes. Baby can be dressed in an outfit you have chosen or wrapped in a blanket before being held. You will be supported to hold baby as long as you wish. Some hospitals in Horizon have a cuddle cot available for parents who have experienced a loss. The cuddle cot is a cooling system that helps prolong the time your family can spend with your baby, allowing you to make memories. A memory box will be created for you and your family. Photos are taken of your baby and stored in the memory box. You may not want the photographs now, but you can keep them to look at later. Other items or information that may be included in the memory box are handprints and footprints, as well as the weight and measurements of your baby. You are welcome to include any special mementos of your own to the box, such as a special outfit, blanket, or teddy bear. Physical effects. Your body is recovering after the delivery, and this can be very difficult to deal with. These are some of the common physical changes that women have after giving birth. Breasts. Any pregnancy that lasts beyond 12 weeks can cause a small amount of milk to be produced after delivery. This is not unusual. It is your body responding normally. Your breasts may become tender. You may notice they are larger and may leak some milk. This can be very emotionally distressful and feel very unfair. In the case of a stillbirth, you may even experience engorgement. Watch for any painful or red, hardened areas in your breast, as well as fever or chills. These can be signs of an infection of one of your milk ducts. Painful breasts may be relieved by wearing a firm, comfortable bra day and night, wearing breast pads to help soak up the milk, applying ice packs or a bag of frozen vegetables covered in a light cloth. Cabbage leaves can be applied for 20 minutes at a time if you do not have a sulfa allergy. Crush them with a rolling pin before applying. Over-the-counter medication can relieve pain, for example, ibuprofen or acetaminophen, and it can be helpful to avoid handling or stimulating your breasts. Medications to suppress lactation are not recommended. Vaginal bleeding. Your vaginal bleeding should decrease daily. Bleeding, spotting, and bloody discharge may continue for a few days, up to 6 weeks after your baby's birth. If you notice the amount of bleeding is increasing, it lasts for more than 6 weeks, or you pass a blood clot larger than the size of a golf ball, please notify your healthcare provider as soon as possible. This vaginal bleeding is called lochia and is different from your period. Due to risk of infection, do not use tampons. Sanitary pads are recommended. Stitches. After a vaginal delivery, you may have swelling or soreness in your vaginal area, and you may also have stitches if you had tearing or an episiotomy. Using a peri-care bottle filled with warm water after voiding or peeing will soothe the area and prevent any further irritation from rough toilet paper. For the first 24 hours after delivery, ice packs, for no longer than 20 minutes at a time, can also help with swelling and pain. In the first few days, take care when sitting down and lie on your side rather than your back. Stitches dissolve on their own by the time the tear or cut has healed. Soaking in the tub 3 times a day for 10 minutes in plain warm water may be helpful. Follow-up care. After your baby is delivered, you will require a 6-week checkup with a healthcare provider. This will be an opportunity to talk about the birth and postpartum issues. Neonatal death. Many neonatal deaths can be attributed to one of the following causes: prematurity, born too early, genetic or health problems, pregnancy or birth complications, or sudden unexplained infant death syndrome. It never helps to blame yourself, no matter what the situation is. The healthcare team, which may include a palliative care or end-of-life specialist, will support you through difficult decisions. An excellent resource is When the Baby Dies in the First Year of Life from the Pregnancy and Infant Loss Network. Our spiritual care team is available to you during your stay. Members of this team are professionally trained to offer multi-faith care in a clinical setting. They can listen and facilitate communication, assess spiritual needs and concerns, offer spiritual support, counseling, and provide support in decision-making, assist in contacting spiritual leaders, arrange sacraments and rituals, such as a blessing for your baby, guide you through the grief process, and pray with or for you and your family. Hospital social workers are available to help address concerns and informational needs of patients and their families. They are specially trained to take into account all the factors that impact upon the emotional and physical health of you and your family, and can provide a wide range of services. For example, referral to outside agencies and community resources. Support for siblings. When grieving, children often experience many of the same emotions adults do, but may be unable to recognize, name, or express these feelings. Each child will react in their own way based on age, development, and life experiences. They will need help to find healthy ways to express their feelings. Talking about the loss of a pregnancy or death of a baby can be hard for parents. An excellent resource is Pregnancy and Infant Loss Network. You may ask yourself, should I tell my child? Or what should I say? These are difficult questions to answer. Children do grieve whether they see your baby or not. They also know that their parents are very sad. It is important to let your children know it was nothing they did, said, or thought that caused the death of your baby. In some areas, a child life specialist may be available to help you with this discussion. Breast milk may be handled in several ways. If you have frozen breast milk, you may decide to donate this milk to a human milk bank. Some people may be uncomfortable with this idea and wish to dispose of it at home or in hospital. Other people may choose to save their milk in a way that is personally meaningful. Do what is comfortable for you. The Human Milk Banking Association of North America can help you find a Canadian milk bank where you may be able to donate your milk. They will also tell you more about the screening and donation process to help you decide if this option is right for you. You may find comfort in being able to help a sick or preterm infant. If you feel this is the right choice for you, you can consult with a lactation consultant to learn how to establish and maintain your milk supply. Pregnancy and Infant Loss Network of Sunnybrook Hospital details a list of rights for parents and babies after a loss. Rights of the parents: to see, touch, hold, and nurture their child with no limitation as to time or frequency. To be fully informed about the baby, the cause of death, and the process of legitimizing the death. To have written and verbal information about options available for burial or funeral, supports available to family members, and necessary legal information. To receive mementos of their baby. To acknowledge the life and death of their child, a person in their family. To choose any type of burial, cremation, or other funeral service. To be heard and listened to by caring professionals without judgment or prejudice. To be cared for by staff who are empathetic, caring, and sensitive to individual responses, behavior, and choices. To be treated with respect and dignity. To have the support of family and/or friends at any time if the parent wishes. To seek religious or cultural support for their choices and to be treated with cultural and religious sensitivity. To be aware of the grieving process, to be able to grieve openly or quietly, and to be informed of and understand the feelings and emotions generated by loss. To understand their future options regarding autopsy and genetic counseling. To be informed about parent support groups. Rights of the baby: to be acknowledged by name and sex. To be treated with respect and dignity. To be with the grieving family whenever possible. To be recognized as a person who has lived and who has died. To receive mementos of their baby. To be remembered with specific mementos. To be nurtured, bathed, dressed, and wrapped. To be buried or cremated. To be remembered. Whether or not your loss has taken place in pregnancy or after delivery, the loss is real. Every response is normal in this abnormal situation. Some of the responses you may experience are emotional, sadness, distraction, anger, feeling inadequate, guilt, emptiness, change in sexual interest, and confusion. Physical: lack of energy, change in appetite and sleep pattern, lack of interest in appearance. Social: feeling alone and abandoned, anxiety about being around mothers and babies, unable to focus on work or relationships, and the desire to be alone. Or spiritual: turning toward or against your religion, feelings of abandonment or anger, and struggling to find meaning in what has happened. Everyone reacts and manages grief differently. Not everyone may understand your feelings of loss. Rest, even if you're unable to sleep. Eat regular, balanced meals. Surround yourself with those who support you. And talk about your feelings with someone who will listen. If you are using alcohol and/or drugs to hide your feelings, you need to talk to someone who will help. There are various support services in the community. Contact the following for direction: healthcare provider, mental health clinic, social work, religious or spiritual care, local support groups, and employee assistance programs. Support resources: NB COPES Child and Family Grief Center. NB COPES stands for Connecting Others, Providing Education and Support. More information can be found on their Facebook or Twitter pages. Now I Lay Me Down to Sleep is an organization that will do professional photographs for no fee. Whenever possible, they should be contacted prior to hospitalization and can be reached on their website. Walk to Remember Moncton is a walk in support of families who have experienced the death of a child in pregnancy or infancy. The walk is a free event and is open to anyone who would like to come and show their support. More information can be found on their website.